Namaskar. We would like to welcome you all on behalf of Independent Research Ethics Society, AYUSH Samriddhi International Webinar Series. At the milestone of 2066, within 4.5 years. Thank you. Thank you very much for joining. And today we are celebrating Meghalaya, Manipur and Tripura Foundation Day. Very unique day. 3 states were established on this day. So thank you very much again for joining from all of the Northeast states. I would like to welcome Neetaji, Dr. R.K. Sharma ji, Dr. Pandit ji, Dr. Rita Madhuri ji, Dr. Lalkim ji, Dr. Mukam Chemyam ji, Dr. Lalu ji, Dr. Vanishun Niesu ji. Sorry, excuse me if I have pronounced anything wrong. First of all, I would like to welcome Dr. Vishnu Prasad Sharma ji for his kind coordination and invitation, and welcome, sir, for your preamble and welcome address. Thank you, Dr. Andy Sharma, sir. Excellent presentation, sir. Namaste. Dr. Vishnu Prasad
Sharma. Thank you. Namaskar. Good evening to everybody. Respected distinguished guests, eminent speaker, ladies and gentlemen. I, Professor Dr. Vishnu Prasad Sharma, welcome all of you for AYUSH Samriddhi International Webinar Series. Today we have Northeast VAIDYA PARAMPARA. Most important subject. Northeast is also a very beautiful place. Every place is more beautiful. People are also very good and beautiful. So in this webinar, we have eminent speaker. I want to welcome Dr. Nita Maheshekar, former director. Namaskar and welcome, madam. Next, I want to welcome Professor Dr. R.K. Sharma, Principal, IA Ayurvedic College and Hospital, USTM from Meghalaya. Namaskar, Dr. R.K. Sharma, and welcome you to this AYUSH Samriddhi webinar. Next, I want to welcome Dr. Saibal Chandra Pandit from Agartala, Tripura. Welcome, Dr. Saibal Pandit, and Namaskar. Next, I want to welcome Dr. Rita Madhuri Devi from Imphal, Manipur. Welcome, Dr. Rita. Next, I want to welcome Dr. Ralte from Aizal.
Good evening.
Namaskar. Good evening. Good evening. Dr. Ralte from Aizal, Mizoram. Welcome, Dr. Ralte. Next, I want to welcome Dr. Mukam Sem Im from Nagaland. Welcome, Dr. Mukam Sem. Next, I want to welcome Dr. Lalu from Nong Tellang from Juai, Shillong. Welcome, Dr. Lalu. Next, I want to welcome Dr. Vishnu Naisu.
Thank you, sir.
Okay, welcome to this AYUSH Samriddhi International webinar. Once again, I welcome all the eminent speakers, distinguished guests, ladies and gentlemen, to this important webinar on Northeast VAIDYA Parampara. Once again, I welcome all of you. Thank you. Namaskar.
Thank you very much, sir. मैं अब आदरणीय अग्निहोत्री सर को I would like to invite Professor Agnihotri sir for his blessings.
Thank you, Professor Pawan Sharma ji. So, sabhi ko namaskar. So we are here to celebrate the day based on the foundation day of a few northeastern states of our country, namely Meghalaya, Manipur, and Tripura. So I welcome all the guest speakers from this sector of our country. Of course, it's very difficult to pronunciate properly because different language and accent are there. So there may be a mistake. Our idea is that before invention of any other pathy, our Ayurveda is running decades together. So in that way, when we talk about the Vaidya Parampara in Northeast states, very naturally it comes the Ayurveda concept. So whenever the Ved is used as professional, not as a surname, it incorporates Ayurvedic knowledge, Ayurvedic based medicines or herbal medicines, and their formulation and management to the sufferings. So we are here to listen a lot of you, and we are grateful that you people, all guest speakers, joined our platform and are going to inform good new informations regarding the Vaidya Parampara of North East state. What I feel that especially Assam and Meghalaya is a little bit rich to extend their service, that they have got the institutes also, and rest our guest speakers will be going to inform all the good information to us. With these words, I welcome again to all the guest speakers of that sector of our country, and also greet them for having their independent states as Meghalaya, Manipur and Tripura. Thank you so much, and over to Professor Pav Sharma ji.
Thank you, sir. Thank you very much. I would like to welcome Dr. C.P. Sharma ji, Dr. Jayesh Thakkar ji. All are welcome here. Nishan Shukla ji. So today our leader is Dr. Vishnu Prasad Sharma ji. He has coordinated, he has invited his disciples and younger brothers. So I would like to invite Dr. Vishnu Prasad Sharma ji first, that when Ayurveda was not there, what was there? In Assam, Mizoram, Tripura. So we are focusing today on Mizoram, Tripura and Meghalaya. So Professor Vishnu Prasad Sharma ji.
थैंक यू। आयुर्वेद नाम से नहीं था, ऐसा बात नहीं, आयुर्वेद नहीं है, बट इन दिस रीजन, नॉर्थ ईस्टर्न रीजन, people consume more herbal drugs. They prefer more herbal drugs. Anything occur, they bring the herbs, make a paste or juice, consume it. Or any injuries occur, make a paste, apply on affected area. In northeastern region, people consume more herbs in comparison to chemical medicine. That is why in this region, people are healthy. If you go to any hilly place, tribal place, they are more strong. If you see their hair is very nice, if you see their skin is very beautiful, everything, because they work hard, they consume more herbs instead of chemical medicine, and they follow the rules regulation of Ayurveda. They get up early in the morning and sleep early evening. And whatever food they consume, most of the food contains herbs. For example, in the northeastern region, in Nagaland, hypertension cases rate are more or less because they consume nefafu leaf in their diet. Nowadays, cases are there, but normally people consume this herb. Again, in Nagaland, the people consume ginseng. Locally, they consume. That is why, if you see people of the Northeast, they are more strong, more healthy. They don't like this chemical type of medicine. If required, nowadays big hospitals are there. They prefer, but first they prefer this Ayurvedic medicine. As a herbal drugs was there, an Ayurvedic practitioner was less at that time, but one or two only people was there, but they are also very expert, because that in our place, Assam, Guwahati, for typhoid fever case, in allopathy, nowadays medicine is available, is there, but in ancient time, medicine was not there. Only Ayurvedic doctor, they cure such type of diseases with Ayurvedic medicine. So from the since time of immemorial from northeastern region, people use regarding herbs for maintain health also, and if anybody have any disease to cure the disease. But nowadays people like more Ayurveda because colleges are also there, hospital are also there, medicine are also available. So thank you, namaskar, over to Pawanji.
Thank you. Thank you very much, sir. Now I would like to invite my dearest Dr. R.K. Dr. R.K. Sharma. Congratulations, Dr. R.K. for principalship of a renowned institute in Meghalaya. Excellent. Welcome, welcome, and again welcome after a long time.
Yeah, thank you, Dr. Pawanji. After a long time, actually, I am joining here. Actually, as you know, that though I am residing in Assam, but it is very beautiful that I'm working in Meghalaya. And after just return from as a principal from Government Ayurvedic College, Guwahati, immediately I have joined USTM as a chief advisor to just actually that was who is actually not only a very visionary person, he is a edupreneur and he is planning to develop all the Ayush stream within his institute. So this idea actually attracted me and I have decided that I should join hand and I have to give my some effort to develop this. And certainly in 2023-24, we are able to start the institute with the blessing of our then Honorable Cabinet Minister from Assam, Sarvananda Sonowalji. The blessings as well as of our Honorable Secretary, who is my good friend, Vaidya Rajesh Katejaji. So we have started it and we are now planning with this institute this under the private sector and the student. And we have started that you have already mentioned that that Assam is little bit ahead of within this all the Northeast, especially in Ayurveda as well in Ayush sector. But I think now the Meghalaya actually bearing the flag and the institute we are planning, that is a 100 capacity institute and the institute having the all excellence with all the facilities. We have a very good facility, especially in Panchakarma as well as the Sarasutra. We have organizing a special camp in every week, especially in Panchakarma, Sarasutra. We have a great response from last few months that on Sarnaprasan, we are regularly performing. And from this time, we are tie up with the All India Institute of Ayurveda. Project, and we are doing is going. We have joined hands, especially our doctors, students. They are involved with that. We are working with various Meghalayas, especially our institute located in Rivoi district. It is a very beautiful district, but we have a very less population. But we want to add up some villages with some Ayush intervention and some already 8 villages we have already started for the total health work on that, and we are adopt this village. Though some people are actually unaware about the Ayurveda, but the message is going to the grassroots level, and people are coming to our OPD and in IPD also. We are performing various surgical and parasurgical little. So with this, as well as our the person who want to develop Ayurveda, as well as in especially Ayush, that they can visit the institute. We have a website there, all the information you will get it. I'm just sharing you that next year this institute we want to develop the homeopathy and Unani course, as because there is a very few number Unani institute in the country. So we are considering it, but the homeopathy also we are planning. So please bless us and you join hand the institute, and we are eagerly waiting with your all the good advice and this thing. So with this word, I am concluding, as because I have another webinar with our others group. So I am with this word.
Thank you, Dr.
Yes, Pavanji.
Thank you very much.
Hello.
Thank you very much. God bless you.
Thank you.
नेक्स्ट मतलब मैं तो वाइस चांसलर की आशा कर रहा हूँ अब भाई, कहाँ वाइस चांसलर बता देना, मिठाई ड्यू है, प्रिंसिपल की भी वाइस चांसलर की भी, सबकी मिठाई ड्यू है. आई हैव टेकन ए रिस्क बाय एडमिटिंग iPhone. Generally we don't admit any suspicious name or phone name, so kindly introduce iPhone. क्योंकि बाद में प्रॉब्लम होगी, उससे पहले इंट्रोडक्शन ले लूं, क्योंकि कई बार प्रयास किया उनने एंट्री करने का, तो मैंने भी सोचा कोई स्पीकर है, अदरवाइज हम लोग अभी 6 दिन पहले हैक हुए हैं, तो इसीलिए जूम बम्बार्डिंग बड़ा गड़बड़ चीज है. नाउ आई वुड लाइक टू इनवाइट डॉक्टर सहवाल चंद्र पंडित सर. वेलकम सर, वेलकम. He is not here. Dr. Rita Madhuri Devi ji. I would like to invite Dr. Rita Madhuri Devi ji.
Yes, sir.
Welcome,
Sir,
welcome.
Sir, thank you once again for giving me another chance in this platform.
It's your platform, madam. It's your platform.
Respected Ramakanta sir, फिर विष्णु प्रसाद sir, फिर sir Agnihotri, फिर all the guest speakers of different Northeast state. Sir, I just want to share the slide too.
Sure, welcome, welcome. iPhone, you have opened the mic?
Yes, sir. No iPhone, I'm just sharing from the laptop.
No, you are not.
I will just share, sir.
Some iPhone is entered. Please introduce yourself. iPhone. Mic is open of iPhone. Do you want to say something?
Yes, sir.
Hello?
Hello?
हाँ जी.
Sir.
Welcome. क्या हुआ?
Sir, I will just share my slide.
You can. There is no obstruction from our side.
Okay, sir.
Yes, your screen is being shared. Please open your.
Sir, just a minute. Sir, it's visible na?
हाँ, कि आईफोन से कौन जुड़े हुए हैं, कृपया अपना परिचय दें।
Sir,
आपकी
my skin is visible or not?
screen is visible, not presentation. Screen is visible.
Achha.
Zoom is written there.
Okay.
Sir, please introduce.
Sir, it's visible now.
Yes.
Yes, now it is visible.
It's visible. So my topic is Vaidya Parampara in Manipur, sir. Let me introduce first. As our respected sir has already told, BPS Sharma sir, Ramakanta Sharma sir has told that Northeast is rich with herbs. So in Manipur also, Northeast already rich with herbs. And before coming to Ayurveda, establishment of first Ayurvedic pharmacy at Imphal by this one, Prasad Shahu in 1961. It is the first Ayurvedic pharmacy in Imphal Pauna Bazar. Then Ayurvedic Bhavan came and Ayush cell was established in Manipur in 1978. Then after that, first BMS nominee under Central Quota 1994. Then Ayush Directorate come in 2025 February. Then under Ayush Directorate, still we are having very less number of manpower. They are under health section, NRSM is come under health section. There are more than 20 Ayurvedic doctors, and in Ayush Directorate, there are only 6 Ayurvedic doctors are there. We have very few limited manpower. And our Manipur is rich with more than 60% of the geographical area of Manipur state is under this one forest area, and each people residing whether in the hill or this one valley. So they used to use, they have traditional healer, what we call local Maibars or Maibis. They have rich knowledge on herbs. Even we have different 7 types of this wasaka, Adhadota wasaka, what we call Nongmangkha in Manipur, different 7 types. And our belief is that our local traditional healers believe it's that the name of this one Sunday, Monday in Manipuri, why we call Nongmaijing Ningthauka Balaibakukpa. 7 name of the week is based on these 7 types of this one wasaka. And even during the COVID-19, there is a well knowledge on steam inhalation of Nongmangkha. When there is any respiratory this one disorder, cough and cold, and even during this one when child is suffering from any cough and cold, then there is the steam inhalation of this one Azadota wasaka. There is the rich knowledge. And during COVID-19 also, people used to use steam inhalation of Azadota wasika. Then we used to give awareness on how to use proper use of steam inhalation of Azadota wasika. And there are lots of this one opinion on different types of opinions from allopathic doctors. For this year, there is no scientific reason for steam inhalation of Azadota wasika or what we call wasaka. Then we used to give awareness on campaign wasaka, the presence of wasacin and wasacinoid. It's a mucolytic activity and it's a bronchodilated activity. People are, it's effect on respiratory tract. We then only this, even nowadays allopathic people also, they came to know about this one importance of wasaka. They became accepted. And there are more than 1,200 medicinal plants, including 430 species are found in Manipur, and maximum medicinal plants which we are using in Ayush system of medicine, whether it is in Ayurvedic, Unani system of medicine, Siddha system of medicine, or homeopathic of system of medicine. So there are maximum numbers of medicinal plants are available in Manipur. But moreover, traditional medicine knowledge are also very rich in Manipur. so there may be quite excellent opportunity for further prospecting. So in 2016, I, along with my co-partner, Dr. Rosina, we used to do literal review research on medicinal plants used by traditional healers. These are the famous, renowned traditional healers. We used to go to their home and used to get knowledge which type of medicine they are using. Even there are knowledge of Tinospora cordifolia, Guruchi. Maximum number of Manipuri traditional healers use Guruchi, even they use leaves of Guruchi, they use barks of Guruchi, even they use the roots of Guruchi in fever and different types of in different condition they use different type of formulations of Guruchi, Tinospora cordifolia in whether in single or compound form. And there is one renowned traditional healer who got Padma Shri award. He's especially famous for this one renal calculi. So these are some of the renowned traditional healer which we met during the study. These are renowned traditional healers. And though we are very limited in numbers, when I joined IRES direct under IRES Secretariat, and now I'm posting at 50-bedded integrated IRES hospital as this one specialist Ayurveda. And when I joined 50-bedded IRES hospital, there was only 5 to 10 patients. Hardly I used to get 5 to 10 patients for specifically Ayurveda. Now, in my OPD, I used to get daily basis 45 to 50 patients, excluding Panchakarma patient, only OPD patient. And for this, we need to do a lot of hard work. In each and every angle, we used to give periodically Ayurveda and women health awareness campaign on, say, we used to give timely, we used to adopt some, this one female famous market, female, what we call IMA market, only run by the female. So these are the some of the pictures which we used to go daily, routinely health checkup, periodically health checkup for the IMA market. And we used to tie it with the ASA and NM and give awareness program on women and health. And these are the different IMA markets run only by the women in different areas of Hill and Valley district of Manipur. We used to give awareness program, free health camp. And even we used to, before this crisis, May 23rd crisis, we along with our Ayurvedic teams goes to remote parts of hilly regions and remote parts of Manipur and give awareness on Ayurveda, concept of Ayurvedic immune booster, how Ayurvedic immune booster can help in systemic immunity and all. So these are periodically, once in a month, we used to do mobile health camp, give awareness program on locality about women empowerment and health. And this one, sir, we all know that Deska Prakriti Parikshan is going on, which is introduced on 29 October by our Honorable Prime Minister Narendra Modi ji. Before that, we were given training on this Deska Prakriti Parikshan in 2020 while I was posted in COVID Care Center as in charge. That time we were given about the Prakriti Parikshan. That time software is not yet developed. So after the training, then I used to take out the this one Prakriti Parikshan materials, and then after when I got the training, then I used to start taking this Prakriti Parikshan for each and every patient in my this one OPD. These are my apprentice who just came for their this one experience, who has completed BMS. So I asked them to take each and every person's Prakriti Parikshan. Accordingly, we used to give medicine, then it's very effective. And now Deska Prakriti Parikshan is going on awareness program every day. We Ayurvedic doctors, though very less in number, manpower, but even in OPD basis, we give extra time to CRPF personnel for Prakriti Parikshan. We used to go in different parts of this Manipur. We work in each and every corner to empower our system Ayurveda on our base level, sir. So every day, Deska Prakriti Parikshan is going on. Different, even we, after the OPD, we used to give extra effort for Deska Prakriti Parikshan in our hospital. So different parts of Manipur. And Ayurveda for wellness at school, even we used to give awareness program in different parts of school and colleges in every different places of this one Manipur. And Ayurveda for One Health campaign, we used to give in different areas, different school, Ayurveda and mental health. On the role of Ayurveda and mental health, we used to give once in a monthly, we used to give awareness program on Ayurveda and mental health. And then patient came to, this particular patient came to our clinic after taking medicine from 2 years. First, he came from renowned allopathic doctors, and he came to our clinic, and we have given, identified his Prakriti. Accordingly, we have given medicine along with Shirodhara. Now, almost he is 90%, his improvement is there, sir. And this one is also specifically, we have identified their Prakriti Parikshans for the mental illness people, those who are suffering from recently from 2023, sir, from this one, our conflict is going on. So there are lots of mental problem there is insecurity in the people. So we have taken extra effort to consider about this particular displaced patient, displaced people who are staying in relief camp. So we have adopted one particular, this one, old age home. We have adopted for 6 months continuously, and every Thursday I used to attend this old age home and give awareness program on every section. I try to give awareness program, and I routinely check up their full body blood skin test. I used to bring our lab assistant and give, along with our apprentice, I used to give their treatment at my base level. And awareness come health checkup in orphanage home. Since last 2 years, due to this displaced person relief camp, those who are staying in relief camp and those who have lost their parents, number of inmates in orphanage home is increasing, and we have taken extra efforts for awareness program, especially on orphanage home too. And distribution of AYUSH kit, different relief camp, we have taken extra effort. And this is the role of Panchakarma on workplace related disorder. This particular patient, he is suffering from computer eye syndrome, stress eye strain syndrome. Then we have given Netratarpan along with Triflagrita. And this particular patient who is suffering from cervical spondylitis due to consistent use of computer in office. Then timely, we used to give a role of Ayurvedic innovation awareness program on Poshan Maha, and even in once in month in our hospital, we used to give awareness program to the patient for at least half an hour. And this mainstreaming Ayurveda now from last 2022, MBBS students, they have included their rotatory internship in our hospital too. So these are this first one is my first MBBS student intern who came for 8 days rotatory internship to our hospital. So we have how we examine our patient according to Ayurvedic concept, and I explain about our Prakriti Parikshan, importance of Ayurveda, body constitution, and all, how we give our medicine and all. They are very satisfied. Still, they used to refer even their patient to in our hospital, and I used to give. We used to give this one training on ASA and NM. And I used to give, we have already given lecture on Prakriti Parikshan on this MOs of Health and Wellness Center of different stream, including Unani doctor, homeopathy doctor, yoga, nature cure doctor, because there is this one checklist they have to fill up about Prakriti Parikshan and all. So in this one also first year MBBS student, their foundation course also since from 2021 I'm continuously taking class for MBBS student. I have taken class for Churachandpur Medical College, फिर Jenims Medical College. Continuously every year I used to take classes on Ayurveda, role of Ayush, and फिर Ayurvedic concept in healthy living. And even Caesar Hospital, renowned hospital in private hospital in Manipur, they used to send basic nurses to our hospital for rotatory internship, and I used to used to take classes to them, and this student also referred patient to our hospital. And proud movement, so the launching of IUS 64 during COVID-19 by our honorable CM. So I was the only female and from our Ayurvedic stream as a concern specialist at that team. And even during our ex honorable governor Laganesa, I have given this one lecture on role of Ayurvedic immune booster during COVID-19 to serve. And one of the most proud moment is our ex-governor Anusaya Ukai, ex-governor. She came to our hospital. She has taken Panchakarma treatment and she was well satisfied with on our Ayurvedic setup, minimum manpower, for patient input and all. And she used to take treatment from our hospital. And success story, there are lots of success story, but in hurry, I could not make all the slides. So there are some patients who came for 3 to 4 years continuously. They are taking medicine from allopathic. Then they came to our hospital, and these are some of the success stories, psoriasis cases. Because patients don't come for the when they suffer, they don't come to Ayurvedic first. Yeah, Ayush system of medicine. They come in later stage, in chronic. Still, we can cure them. These are some of the success story. So what I want to highlight is, though we are very few in number, if we try, then we can do much. So Jivet Sarada Satam, let's adopt Ayurvedic concept of healthy living, and let's live for 100 years of Sarada. Thank you, sir.
Excellent, excellent, beta.
Thank
God bless
you.
you. शानदार
Thank you, sir.
presentation. शानदार presentation.
Thank you, sir.
मैं आदरणीय डॉक्टर शैवाल पंडित जी को सादर आमंत्रित करता हूं।
सर
सर मैं बहुत देर
मेरा
से एंट्री
मेरा
नहीं
बात
देखा।
सुनाई पड़ रहा है ना?
आ रहा सर।
Okay,
वेलकम
sir.
वेलकम सर।
Okay, sir. Sir, very nice program is going on. A very nice program is going on. I am very much happy that I was invited in this program. Northeast Buddha Parampara. That should be highlighted among the Northeast region. See, Ayurveda is a very ancient, but still today is very much effective. And we are in lot of challenges at this moment also. Even we are trying to understand the rich persons for better health. In our state of Tripura, the Ayurvedic status is that since the Ayurveda is started 1952. हेलो सर, सुनाई पड़ रहा है ना?
पूरा सुनाई पड़ रहा है सर, सुनाई पड़ रहा है।
1952 से ये शुरू हुआ आयुर्वेद इन त्रिपुरा फ्रॉम गवर्नमेंट साइड, एंड रेगुलर डॉक्टर रिक्रूटमेंट का जो प्रॉब्लम था हम लोगों को, तो टीपीसी थ्रू टीपीसी आयुर्वेदिक डॉक्टर रिक्रूटमेंट हुआ, but it is a very limited. At present, only 25 doctors, regular doctors are working, and 42 NHM doctors are working in Tripura. This is the simple story.
মিঠাইখিনি অফাৰে ল'বা আমাৰ বন লৈছা নেকি
One hospital, that is 50-bedded hospital, only Ayurvedic hospital, that is in the heart of the city in Tripura. Medicinal plants are quite available. We have no any medical college, no manufacturing unit, only in administration, only branch officer, only one branch officer is looking the total state. This is the scenario in Tripura. The health service rule is implemented, and council is also implemented, but the academic problem is always there. NHM doctors are not getting the equal salary, but the public interest is more and more. Even though there is no recruitment, several times we met to the ministers for recruitment of Ayurvedic doctor. Even since 2008 onwards, there are no recruitment in the state of Tripura. That is why doctors are very few in number, regular doctor. So even the budget, medicine purchase budget is very minimum, only 75,000 to 10 lakhs, sometimes 1 crore. So it is also limited. Budget should be raised in Tripura for supplying the common medicine to all the dispensaries, even PEC, CEC. So our NHM doctor, they are suffering that they are not getting the opportunity in OPD outdoor. They are engaged with the all national activities. So Ayurveda popularity is becoming very less, but we are trying through the health awareness and health camp organizing by a local club or other NGOs. They are working along with us. In this way, we are spreading the Ayurvedic knowledge, Ayurvedic words amongst the society. There is no naturopathy doctor, no Unani doctor. So only Ayurveda and homeopathy under the AYUSH system. We are trying too much, but as there is no directorate, separate directorate, so there is no person to say regarding the Ayurvedic development, no manufacturing unit, government not approve the Ayurvedic doctor recruitment. These are the problems still. But one Ayurvedic hospital, 50 bedded, it is running well. The patients are coming, getting benefit, and government is also satisfied with our works. So this is the very simple one. There are 5 locations of Panchakarma under the government level. Panchakarma, separate Panchakarma hospital is also there under the forest department and state government. So this is a simple Ayurvedic development in Tripura. Okay, sir. Thank you.
Thank you, sir. Thank you very much for your kind blessings. I tried to contact you twice, but unfortunately unable. Sorry.
Okay, sir.
Thank you. Thank you very much, sir.
Okay, sir. Okay,
Vishnu
sir.
Prasad ji, your comments.
Okay, thank you, Dr. Soiwal Pandit, for your nice explanation. Thank you.
Thank you, sir.
Thank you very much.
Thank you, sir.
Now, as per the sequence, I would like to request Dr. Lalton Kivi Lalte. Dr. Lalu. Welcome, Dr. Lalu. वेलकम वेलकम। आप लोग जुड़ते रहिएगा, मैं तो यूं कहूंगा। थैंक यू विष्णु प्रसाद शर्मा सर, आपने इंट्रोड्यूस कराया, लेकिन यंग जनरेशन आप लोग जुड़ेंगे। प्लीज, आई एम स्टैंडिंगली inviting you for all the webinars for clinical subject. I am confident that our pillar, Dr. Vishnu Prasad Sharma sir, will circulate you link for that. So welcome, doctor. Welcome. What is your pronunciation? First, your name, pronunciation, please guide me.
Yes, sir. First of all, I'm so grateful to be a part of this program. When BVP Sharma was telling me, I said, oh, maybe I cannot, do you have to prepare a presentation or something like that? They said, it's okay, you can just share your clinical view or your knowledge about your Ayurveda. So my name is Roy Wandaka Lalu, which can be translated into Aishwarya in Hindi. So it's basically
Welcome.
our place to bring prosperities to the families. A female child will always have this name Roy because we are matrimonial and matrilineage area. So I am working as a Ayush physician in some community health center. Apart from that, working in a community health center, we have very less Ayurvedic supply. So before that, I started opening my clinic in 2014 after resigning from my job because of the inconveniences and family issue. So I started my clinic, and really I could say that it is a. When I just started my clinic, I want table and chair, and I still remember I have a mustard oil. Sir, can like locally we can say mustard oil, and I started a panchakarma therapy by doing abhyanga, bashpa sweda, shirodhara, and patrapinda sweda, along with nasya, the upakarma we can say nasya. Slowly, I started basti karma also, along with the help of our renowned BVP sir. Through his guidance, I started a basti karma, and also I started 3 to 4 patients in my clinic. So I think sir has been visited many times because we had been hand in hand with the research from NIPER Guwahati, and also with many CMEs has been conducted in the clinic. Yes, of course, I could say the traditional way of healing has been utilizing by our grandparents, no doubt about it. We are here today with the blessing of their knowledge, starting from the kitchen to the clinic. Why I'm telling like that? Because when we look in our in the kitchen point of view, we started haldi, we started using pepper, maricha, we can say ginger, bay leaf. All these are the recipes, the spices which we are using in our diet. But I can say, like coming to the clinical point of view, turmeric, haldi, we can say we use it in many skin diseases, and also I have been used in sinusitis, where we use it in the form of nasia. A fresh uh, turmeric is taken and squeeze it. That juice is used for nasya karma in the form of nasya for the polyps and also for severe migraine. Because I started the clinic, I thought like maybe people would not come to me, maybe they will be afraid of using this kind of oil to instill into our nose. But I would say I am totally wrong. You know, when they come, I have the maximum patient of nasya for doing nasya karma. They are like having sinus problem, migraine, these polyps, and some cases where they have recurrent, they have done polyectomy. So, uh, so I could say that yes, we have to take initiative by our own. No doubt, if we say like no, maybe people won't come. That is like it's our wrong mentality. So in Meghalaya, as passion fruits, I don't know when I say passion fruit, everyone is able to identify or not. It's a fruit which is, you know, the which has a trifoliate leaf. Here in Meghalaya, we use it for hypertension. During our grandma, they never take, antihypertensive drugs. Why? Because every every night they used to drink the decoction or the leaf. Simple, just pluck some 4 to 5 leaves and then steam it in a water and then drink it. Or sometimes they eat it, the leaf. Yeah, it is bitter. I'm also trying to take it as the age is consuming. So uh, yes, of course, comparatively, as sir already told, that comparative with the previous scenario and with this new generation, I would not say that there is no hypertensive tension case in Meghalaya. But nowadays, with the changes of the lifestyle, with the work responsibilities, many people are suffering because they forget what our grandparent has taught us. So a few more plan I would like to tell, like pitch plan. A pitch plan is available only in Meghalaya. I am so sorry I could not do any presentation where I would show how they look. You know, the its botanical name is Khasiana. So this pitch plan, it has a water collection naturally. It collects the water, and the lid of the pitcher plant is covered. So when it is covered, they used to say that it is a kind of a distilled water, and when you drink that water, it kill it it removes the gallbladder stones, and kidney stones. So recently, I have been in one school health program where we visited one school, and in that area, the pitcher plant is very, very famous. It grow all over their backyard, their garden, their playground. So after the screening of each and every child, one children came and brought me a plastic of pitcher plant, and she said, "Doctor, I want to give you this pitcher plant as a gift." So I said, being an Ayurvedic doctor, having settled and stayed in Meghalaya, and we know the endangered species present, that is one of the endangered plant. I haven't drank not even one sip of that, haven't taste. So that day, I opened it in front of that girl and I said, "Yes, today I'm going to drink and I'm going to taste this water." And I'm also expecting that maybe in the future I would take this water for kind of a, research purpose, like what it content, because simply taking like that, it might be hampered or it might have some other disadvantage. So I collect all that picture plan and I took it home. And when I came home, one of the old lady, the mother of my helper, she said, "Give it to me. It is like I will drink it. If I get to drink this, all my UTI problem will solve." So it is like a big question in front of me, and I said, "Oh my God, I would have gone and do something, some research work on this plant." So that was just a plant, a plant in my mind. Let's say what it might be content. So when I taste, I just want to share you. When I taste that water, it was like little bit kind of a salty water, and it is uh, very good. I just feel the taste was not so bad. It was like kind of a distilled water. Yeah. So maybe in the future I'm able to update you all regarding that. And as you know, in Meghalaya, the Piper longum and the Piper nigrum is very, very these spices, the costliest spices, and it grows uh, very much in this kind of in the south kind of Meghalaya. So Piper longum is one of the best herbs to treat rheumatoid arthritis. See, Meghalaya is a very cold and a clammy area where the temperature drops at any time. I would say now itself, I was about to call BBP sir to say that, "Sir, it's too late because it's very cold here and I have to cover a blanket and sitting and speaking to you. If it extend more, maybe I could not able to be with the program because I still have a baby of 1 year." So I hope that they won't get up. Okay, and yeah, Piper longum. I wanted to share because people used to take Piper longum in a form of like classically. I have been studied as Pippali Vardhamana Rasayana, where they used to take one Pippali in a day on empty stomach, then they increase it to 3 up to 10, sometime up to 20. So that was the reason behind of having stayed in a very marshy or a cold clammy area. The cases of rheumatoid arthritis is less comparatively with now. At present, uh, yeah, we have already shared maybe the lifestyle and so on and so forth, or maybe the consumption of Piper longum is totally withdrawal from our diet, because nowadays we always use Piper nigrum. We hardly use Piper longum in our diet. So maybe because of that. So apart from that, I wanted to say, yes, concluding the Nasya Karma, uh, one cases of Bell palsy, one or two cases where they were about, to not recovering from their the drooping of the eyes. So I think when I started Nasya, uh, it was like a very active case. Immediately when she have the attack, she came to the clinic, and it was like a very good result. She the Bell palsy was corrected, and yeah, of course the look matters a lot because of the social stigma and all. So when you get cured, people related with their look or something, with the eyes drooping like that in the Bell palsy. Really, it's really thankful to to our acharya who has been taught us for doing such a grateful treatment like Nasya. So there are many other Shirodhara and other. I have been treated. I have a very successful case for alopecia. Because of the stress and many other smoking or many other bad habits, people of young age are having alopecia cases, having hair fall problem. So they came to visit our clinic, and we do Shirodhara with Takra, and also with Amalaki we use. And it seems like the patient was really satisfied for the treatment. And not only did that, we in my clinic, I have been practicing all the panchakarma and the upakramas, but except the rakta mokshan and the jalauka chikitsa. So, regarding Jaloka also, when I was walking in one of the area and the Assam side, I have been selected some of the Jalauka, and I could not identify which one is bad, which one is good. But yes, of course, this Jalauka also, we can say that in a traditional way during our grandpas, they used to tell that there are some jalaukas which when they stick into your skin or into your blood, in a kind of a wound type. If you have a wound, they said that you won't feel the pain, because at that moment they suck the bad things, the unpure blood, we can say, and the pus or whatever the things present inside that area or the wound. But when the jalauka will reach to the the main the actual blood of our, like, the the non detoxified blood, the non poisonous one, you can say, like that time, there will be an itching itself. So yeah, we can refer to our classical way of treating rakta mokshan with by using jalauka. So I think, yes, Ayurveda in Meghalaya is not only like, we have to go back to our previous mother, grandmas, and grandparents, so that we have to document all these things. Why we left like this? Why we have to go and study Ayurveda in different, in different place, or in a very good Ayurvedic clinic? Because Ayurveda is nowhere, you can say, like, you are not an Ayurvedic doctor. Every one of us is an Ayurvedic doctor, starting from your grandma till your children, because each and everything we have to document it. If we are not documenting it, we cannot say anything. So there are so many things which I wanted to share, but I don't know time will permit me or not. But before I conclude my speech, I would like to say, like, not only practicing panchakarma, we also uh, uh, educate children about the medicinal plant. I always do that. Unfortunately, I have been plant 300 species of Arjuna in my place here in Meghalaya. In the first few months, it was started to, it started to grow. I thought, like, maybe small buds are started coming. I know the temperature is not suitable, but I'm just trying. So in that on that is aspect, I have planted around 100 Arjuna along with bay leaf, the Amalaki, and few of the plants which are like need to be preserved here in Meghalaya in my herbal garden. So why I'm planning this, because I wanted to show the children. See, these plants when they saw the plant showing their interest, and we need to show them the plan and show them for what kind it is used, for what purpose it is used. Simple small neem leaf you can show them, or small the what can say like a ginger roots or some turmeric roots. If you see this, it can be healing in so and so on. It can simply relieve your cuts on wound when you fall down. You can just take the turmeric, chew it, and just put it into the wound. It will automatically stop the bleeding. So, apart from that, I'm also used to work with Naipur Guwahati. It is one of the research center where we wanted to keep researching many plants in Meghalaya. Right now, we are working on Rus coriaria, which is available here in Meghalaya. Rus coriaria is a very salty kind of a plant. The fruits, I mean, its fruit we usually uh, sell in the market. Now it is a season. They sell in the market. They just take the fruit, and it has a natural way of salty appearance. So when you collect the fruit, it has the salty patches, just like you take the salt and dip. You take the fruit and dip in salt. The same thing like that. It's spread with salt all over, and that fruit it can be taken, dry it, and then use it for anti-diarrhea and many stomach pain, and also in many cases like liver cirrhosis and fatty liver. So right now I'm in the process of of doing the work regarding that Rus coriaria, which is the botanical name. Apart from that, we also keep working with this plantago. I think sir might be very aware. It is a plant where they used to take for the menstrual pain. That is also a ongoing plan which we are working with the Naiperji. So that was regarding the work which we are doing. So I unfortunately, according to program, I could not update anything regarding Meghalaya status. But yes, I could say that as our retired director is also shared the 10 bedded which is present in Bhoirambong, and here recently they have been opening here in Rambai the 10 bedded hospital, Ayurvedic hospital, and also soon it will be opening in Sora. So I think with this people will turn back. I can say they already have will turn back to Ayurveda and prove that yes, Ayurveda not only in kitchen, in clinic also it can be done. I'm expecting many more from this webinar. It was just a starting, and it was a first time webinar for me. And I hope I'm not bored to you, and whatever I'm telling, it will be helpful to all of you. So I am just a student here, and I have to learn many things from you. So my blessing will always there with you. If anything is there, I'm sure I'm able to wanted to visit Meghalaya, Miss. Please do contact me. I'm here to serve you on that day. So thank you one and all. Thank you, sir.
Thank you, Dr. Lalu, for your excellent presentation. Though you have given all explanation very nicely, your place is very cold place. Though at night. Now it is 10:46, but you delivered your lecture very nicely. So thank you. God bless you. Okay.
God bless you.
Thank
Really, God bless
Hmm.
you. एक बार बोलना शुरू की तो फिर धारा प्रवाह बोलती चली। वाह 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 वाह। हमारे और कोई वक्ता बाकी हैं? मेरे हिसाब से, मेरा मानना है नहीं है। तो विष्णु प्रसाद शर्मा जी और अग्निहोत्री सर के पहले मैं डॉक्टर सीपी शर्मा जी को बुलाना चाहता हूँ। आदरणीय डॉक्टर सीपी शर्मा जी, एक्स जॉइंट डायरेक्टर, गवर्नमेंट ऑफ एमपी। आदरणीय सीपी शर्मा जी हैं क्या?
जी जी सर।
स्वागत है, स्वागत है, स्वागत है सर, स्वागत है।
सर अभी सर एक मैं शादी कार्यक्रम में हूँ, तो मैं ज्यादा सुन नहीं पाया। और जहाँ तक आज के जो वेबिनार रहे, उसमें जितनी भी प्रस्तुतियां रही, सभी प्रस्तुतियों में अधिकारी वक्ताओं द्वारा सिद्धांततः अपने विषय की प्रस्तुति दी। इसके लिए सभी को धन्यवाद। और नॉर्थ ईस्ट से और नॉर्थ ईस्ट में आयुर्वेद की वस्तुस्थिति एवं वहाँ आयुर्वेद की चिकित्सकीय व्यवस्था के बारे में वक्ताओं ने प्रस्तुति दी। सभी का स्तरीय प्रस्तुति रही। सभी को सादर प्रणाम करते हुए साधुवाद देता हूँ। इन्हीं शब्दों के साथ मैं अभी एक शादी कार्यक्रम में हूँ सर। थोड़ा
मैं आदरणीय अग्निहोत्री सर को प्रार्थना करता हूँ।
Thank you, Professor Pawan Sharma ji. Really, it was a great session, of course, that Northeast states representatives really poured fullest knowledge, whatever is happening there, with special reference to Ayurveda, herbology, and also all the aspects of Panchakarma, of course, even up to Jaloka, though it is not much in practice, but it is really an information that Dr. Lalu presented very well. She took full time, and I have got all sympathy with her, as she told that she is having a very low temperature there and having a 1-year-old baby. So really, our all the support with her, and still she continued. After saying this thing, she took next 10 minutes to continue. So this is what the zeal and pleasure that she is dealing with Ayurveda, and started right from her own clinic after leaving the government job and doing very well. So it's our addition to the knowledge that she has informed that 300 types species of Arjun, and she is having a good plan to take out how much it could be, and rest very important information regarding the pitcher plant. I think that is hyacinth. Is it?
Yes.
That wonderful plant is there, and here in our country, in other states, it is coming from the ponds, and fullest of the area is covered by the abruptly cultivated these pitcher plants, and it has got its ashes, if been prepared in Pushya Nakshatra or in Shatvishya Nakshatra. It has got the difference in the nanoparticle size, and the work is done in Begusarai and Patna. And one of my student and now assistant professor, Dr. Dinesh Yadav, is involved there, and they are working on oncology department with the Medical College Patna, and it has got a wonderful effect over the even cancer patients, and also one of the choicest medicine for this prostate enlargement. So, you told about the pitcher plants used in this gallbladder stone and renal stone both. So it is a wonderful medicine if it is useful in gallbladder cases, because gallbladder is always not so manageable because it's not having a direct track to take out the either the sand or the stone as such from the loop. So your presentation and information is really touching, and Meghalaya, our Northeast Institute of Ayurveda and Homeopathy, that is there in Shillong. Our your ex-director, Dr. Nina, and she this presented someone, and Professor Dr. Vijay Kumar Dwivedi is there. He's head of department in Swasthya department there in Meghalaya, Shillong. So you can go for the its preparation, its ashes as a medicine for prostate cases,
Oh,
BPH cases. So I am
is
really thrilled with all the guest speakers of Northeast region, especially right from Professor Vishwanath Sharma ji from Guwahati to our R.K. Sharma Sahab and our Pandit Sahab, and also Dr. I will try to spell properly, Dr. Rao Vandalkalu.
one.
Lalu means that is the Aishwarya one. So really,
Yes.
you are doing a lot. You are doing wonderful. And God bless you. And with these words, I extend my all the appreciation and thankfulness to all the guest speakers of today's this webinar, which was our arranged on the foundation day of our three states, Meghalaya, Manipur, and Tripura. So thanks all the participants, the speakers, our guest speakers, Dr. C.P. Sharma sir, or our Professor V.P. Sharma Sahab, Dr. Vaidya, Jayesh Thakkarji, Professor Pawan Sharma ji, each and every person, one and all. So thanks and Shivratri, all of you.
Nice.
Namaskar. Over to Professor Pawan Sharma ji. So please take care of you and your family and baby, everyone. Okay. Over to Professor Pawan. Take care, protect yourself from extreme cold, have all pullovers and blanket and heater, whatever the devices are there, because it's really extreme cold, and that too at that northern area of coldest place, I should think. What is your temperature there now, right now? In minus?
No, not minus, sir.
Okay. 3,
12.
4, 12? Then it's okay. Here it is 3 to 6 in Haridwar, Uttarakhand. In daytime, it was better. It was 16. Now it is almost near to 9, 10. Even otherwise, take care and be very careful regarding this cold exposure. Thank you, everybody. Namaskar.
Thank you, namaskar. Thank you to everybody, all experts from Northeastern region, not from the Northeast.
Sure.
Thank you, sir. Thank you to all. जयेश जी, बहुत बहुत धन्यवाद आपको जुड़ने के लिए. थैंक यू. शहबाल पंडित जी, बहुत बहुत नमस्कार आपको. बहुत बहुत नमस्कार. अग्निहोत्री सर, प्रणाम.